The PQ and the Liberals have abandoned our healthcare system. They have basically given up. The new reality, confirmed under both Philippe Couillard and Régent Hébert, is for a Quebec family not having a family doctor, waiting 17 hours at the emergency room, and waiting for months to get an appointment with a specialist. Quebecers deserve better. Team Adrien Pouliot, Conservative Party of Quebec, is not giving up. We won't let the system go bankrupt. But we need new solutions, not the old rehash of the Liberals and the Péquistes. Did you know that a majority of Quebecers believe that the private sector can be used to support the public system so we can have better health care for our families? So do we. Now, this does not mean that we will abandon universality. The thickness of your wallet should not decide if you will have access to our hospitals or not. Here's how the private sector can help the public sector. First, we should allow private hospitals. Doctors who work in the public sector should have the right to work in the private sector once they have performed a certain minimum of hours in the public sector, so as not to drain the government system. Secondly, we should allow Quebecers to purchase private insurance so that they can be treated in a private hospital. This will allow all of the middle class in Quebec to have access to private health care. And as a bonus, it will free up the public sector. Third, we will pay hospitals based on the number of activities they perform. Right now, their budget is based on the previous year's budget. Whether the treatment you receive is successful or not, whether they are clean or filthy, whether you wait at the emergency room 1 hour or 1 day, they get paid the same. So what's their incentive to improve? We will implement an activity-based funding system. This new approach will reward hospitals who treat more patients. Hospitals will need to treat their patients like customers. Imagine that. They will need to treat their patients more efficiently to generate more revenue, and that in turn will reduce wait times. Hospitals who don't will lose patients to other competing hospitals. We will require hospitals to provide a 30-day warranty for their activities so that if a patient has to come back to the hospital within 30 days, it will not be paid a second time for that second visit. Now, we're not reinventing the wheel here. This system exists elsewhere. It exists in Australia, in Austria, in Belgium, the Czech Republic, Denmark, Germany, Hungary, Italy, Japan, New Zealand, Norway, Sweden, and Switzerland. Those are but a few of the practical and concrete ideas of the Team Adrien Pouliot Conservative Party of Quebec to put Quebec back on track. My name is Adrien Pouliot. I am the leader of Team Adrien Pouliot Quebec Conservative Party. See you next time.